And time for a talk of the town. It's the last one for September. Yeah, and there we go. And of course, that means it's flu season, so we bring in our flu lady, I guess, Karen Fountain from Steele County Public Health and Flu Season. We have to get prepared for that. And any talk much about flu this year, Karen, as far as hints that it might be a bad year or a good year or enough vaccine or anything at all?
So far, it's been quiet, and so that's why we're kind of in a grace period here where we would like to remind people how important it is to get vaccinated. So we'll be ready, and we all know that what type of flu season we have is very unpredictable. So at this point, we just don't know what is going to happen, but we do know that we will be having flu activity later on in the winter, and so we want to remind people this is the time to get your flu vaccination.
I guess that's a fact. There's probably never, ever, ever been a time there hasn't been somebody sick with the flu. That's a fact.
That's exactly right. Even in years where it's mild, it still affects people that are hospitalized, and sadly, there still are deaths.
And there's some clinics coming up, but is there a certain group of people where you say you really, 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 you're the ones that really should get a shot?
There are groups of people that if they get the influenza, they're more likely to suffer more serious complications, hospitalizations, and maybe even death. And those are people over the age of 65, children under the age of 2, pregnant women, people that have chronic medical conditions such as asthma, diabetes, heart disease, and lung disease.
Do you know offhand, does the flu sometimes like develop into pneumonia and that's what kills people, or
Yes.
that's what it is? Yeah?
Yes, usually when there's a complication from the flu, it attacks some organ systems, and it would normally be the lung or the heart, but especially the lungs, and people get pneumonia.
Okay. Now we have clinics getting underway. There's some in the schools. We'll get to those in a bit. But first off, we have the clinics coming up starting next week. The seasonal flu shot that's offered by you, the Steele County Public Health.
Yes, it is, and we offer it to people ages 18 and older. And on Tuesday, we're going to be in Medford at Medford Manor, and that will be from 9 to 10:30. On Wednesday, we go to Ellendale, to the Ellendale Community Center, and those hours are 12:30 to 2. We're back in Owatonna on Thursday the 6th from 9 to 11 at the Owatonna Senior Place, and we end up in Blooming Prairie on Friday the 7th from 12 to 2 o'clock at the Blooming Prairie Senior Dining.
Okay, and those shots cost how much?
Those shots, usually it's covered by insurance, and so bring your insurance cards. If you don't have insurance, you can pay $35 cash, or you could come to our office, and at our office we have vaccine that is specially designated for people that do not have insurance.
And it's just plain simple. It's a shot. That's it, and you're done in just a few seconds.
Yes, yes. Nobody likes to get a shot, but we do it quick.
Yeah, well, I guess lying in the hospital with pneumonia versus a little prick in the arm, I think I know what I'd pick like that. You don't need an appointment, just simply show up.
Yes, for these 4 seasonal flu clinics that are next week. And then if for whatever reason you're unable to attend one of these clinics due to work or conflicts with other activities, you're always welcome to come to our office at 635 Florence Avenue, Monday through Friday from 8 to 4.
Do you need to call ahead for that, or
No,
just pop in?
you don't. And at our office, we have vaccine available for anyone 6 months and older. However, at the flu clinics that we're holding out in the community, we ask people to be 18 years or older.
Okay. And then also starting next week, and then continuing spread out through the next 6 weeks or so, the schools, you'll be going to those, and talk a little bit about those.
Okay. This isn't Steele County Public Health that goes into the schools, but the schools have made arrangements for a company called Homeland Health Specialists to come into the 4 schools in Steele County and offer vaccinations. And those will be starting October the 5th next week at Medford Public School from 3:30 to 7:30, at Blooming Prairie on the 24th from 4:30 to 7:30, at Ellendale on the 24th also from 4 to 7, and on November 5th here in Owatonna at the Roosevelt School in Owatonna, and that is a Saturday from 9 to 12. One thing we want to remind people is Homeland Health does not accept checks, and so if you're going to be paying for this with cash, paying for this yourself, bring cash.
Okay, and again, this is just the public as well. Just because it's in the school doesn't mean it's just for the students, right? Or
Exactly. It's school sponsored, however, because it's in the evening, they want to open it up to the public. And this is for people that maybe work out of town. Their schedule is tricky for them to make an appointment at a clinic. And so this way they can come after work and bring their family.
okay. And I guess we'll talk maybe a little bit about the flu itself exactly. I guess before we always talked about this. As a young guy, I always thought throwing up, that's the flu, coughing, that's a cold, but that's definitely not the case. Talk a little bit about the flu and how you know or suspect you may have it.
Okay, there are cold viruses, and cold viruses, we all know, for the most part, are in our nose. However, the influenza viruses can go into our lungs. And so what they do is they make people, usually you have a fever, a higher fever than with a normal cold, which is usually pretty low grade. You have a cough, sore throat, headache, and you just feel extremely tired and extremely achy, and you feel awful. And usually you don't feel like doing anything but laying on your sofa or bed for maybe anywhere from 3 to 5 days.
Do you need to feel healthy to get your flu shot? I mean, if you don't feel quite right, should you wait a day or two or not?
Our rule of thumb is that if you have a temperature of over 100.3, that's 100.3, usually we recommend that you wait until your fever goes down. But usually people, even if you have a head cold or you're on antibiotics, those aren't contraindications for getting the flu shot that day. It would just be that you feel lousy because maybe you have a cold that's hit you pretty hard and you say, I think I'll wait with the flu shot.
Okay, and these flu shots, this doesn't help that you get it done twice, does it? One shot should be it.
Yes, sometimes people ask that, when we have a really bad influenza season and it's hitting hard in February or March, should I get another vaccination? And we say no. For the most part, the vaccination should last the entire year.
Okay, that was the next time I was going to say that. Well, I'm thinking it's going to be February, March. I might be better off. It'll be stronger if I get my shot in December.
Yes.
That's not true.
The only caveat that we would offer is that for people 65 and older, they're not going to get probably as good of response from the flu vaccine, just because as we get older, our immune system isn't quite as effective as building up antibodies from the flu vaccine. And so for senior citizens, sometimes you're better off waiting until October to get your flu shot in case we might have a late flu season, maybe occurring in March. But it's a difficult call because we know people get worried, and especially seniors can get hit so hard by that flu. And so if you have an opportunity to get the influenza vaccination, take it.
Okay. There are people who are just terrified of a needle. Are there other options or not?
We used to have the intranasal, which was called flu mist. And the CDC was looking at the research because they track on the effectiveness of different vaccines. And the research they looked at for the last 3 years was showing that the flu mist or intranasal was not offering the protection to the same level as the shot in the arm. And so what they have done for this year is not offered the flu mist and recommended that all children who maybe last year got the flu mist to go to the shot. We know that parents liked the intranasal because it was less invasive and perhaps the child, didn't become so frightened. But we're in hopes that this won't stop parents from bringing their children in still to get vaccinations.
Okay. And these clinics next week, like Medford, Owatonna, Blooming Prairie, Ellendale, do you have to live in that town? Or, if you live in Waseca County but work in Owatonna, can you get your shot?
No, there are absolutely no restrictions.
Okay, I didn't think so, but people come up with all kinds of questions, so I'm trying to ask them.
Yeah, it's a good question.
Yeah, so our first one coming up is Tuesday already at the Medford Manor, 9 to 10:30. Anything else we need to do as far as talking about flu season or these flu shots, Karen?
The only other point that I'd like to make a couple points, and one is that people may not realize this, but sometimes people don't get influenza vaccinations, and they say, well, if I get the influenza, I'll just stay home. You know, one thing that we want to stress is that people can spread the influenza to other people 1 to 2 days before they start to show symptoms. So that means that you could be spreading that influenza to your loved ones and to other people you're coming in contact with even before you get ill. And so that is a real good reason why we want you to get vaccinated, to help protect your loved ones and those you come in contact with. And then I think the second caveat we want to say is that teenagers and young adults they don't have very high influenza vaccination rates. I think that they live busy lives. It's hard for them to get in and get a flu shot, but it is very important for these age groups to get vaccinated because of the fact that they're at pretty high risk of getting the influenza because they're out and about and they can spread it and contract it pretty easily. And one statistic people may not be aware of, but every year at least 50% of children that contract the influenza, and sometimes there are actually pediatric deaths. These are in healthy children who had no underlying health issues. It's just that influenza hit them really hard. And so we feel that the influenza can be very dangerous, and we want people to get vaccinated. Everyone 6 months and older.
Okay. And if you have any questions, Steele County Public Health, their number is 444-7650. And that's our Talk of the Town for today on AM 1390.